And we are back with the Dr. Joe Show with Dr. Joseph Biederman. And while off air, but on Facebook Live, I asked Dr. Biederman a question that I'm going to ask again. Um, you mentioned that folks, it's more dangerous if they're not treated. And my question to you was, is that because they tend to self-medicate? And your answer was,
No, absolutely not. I think that I recently did the following exercise. Uh, Today, we have access to what's called big data, millions of people, kind of registries, insurance company, electronic medical records. I can mine the entire partner's healthcare electronic medical record. For example, I'm examining now the important question of whether ADHD treatment affects growth in height. And most of the data are from clinical trials that are rarified samples. So I can examine that question in an ecologically informative way. So I published a paper that reviewed, it's called literature review of all big data set with millions of people in it. And I asked a question, I looked at functional outcomes, suicide risk, traumatic brain injury, accidents, automobile accidents, visit to the emergency room, depression, bipolar illness, addiction, not just addictions, okay? And ADHD increases all these risks. Treatment mitigates all of these risks. Okay, so those people, because you can link those data sets to treatment data sets. So you can answer the question, those people that are treated and are compliant with their treatment, do they have the same outcome? The answer is no. Imagine if you, ADHD is a risk for suicide. Okay. No, there is no argument in any of us that suicide is a bad outcome. No,
yeah, yeah,
treatment treatment of ADHD markedly decreases that risk. To give an example, so people are a little bit over focused on the addiction issue. That's one of many horrendous outcomes that in themselves are devastating. For example, traumatic brain injury is a terrible problem, okay? Particularly sports injuries. So people with ADHD are at much higher risk to have a traumatic brain injury and complicate with a traumatic brain injury. That means they recover very, very slowly. So after a traumatic brain injury, they may have a lot of problems regaining function. Mm, Their peers that may have the same injury may recover much better. But so the over focusing on addiction as the only bad outcome, I would say that getting killed in a car accident is a much worse outcome than drinking beer. Okay,
mhm,
and ADHD will do all of the above. Okay, it's a very, very significant risk for automobile crashes. Very significant risk. Not only they have more automobile crashes, people with ADHD unmedicated, but the car crash is more severe. How do we know it's more severe? By the cost of the repair. Okay, so they maim themselves, they maim others. I personally have patients that run over pedestrian and kill them. Imagine a 20-year-old in college running over a classmate and killing the classmate. How you live with that the rest of your life, no? So those are the things you change the radio station for a moment and that's it. Doesn't need much. So I think that if over focusing on addictions as the only problem of ADHD is a real disservice to the enormity of the problem. Enormity of the problem. If you take any psychiatric condition, garden variety adult psychiatric, depression, anxiety, PTSD, whatever you want, 20 to 30% of any of those patients also have ADHD. And ADHD will bring to the table all the complications of ADHD, and the treatment of depression or anxiety does not treat ADHD. So you still remain highly impaired even if you successfully treat depression. So is it if you suffer from diabetes or cardiovascular disease and you don't take your medicine, you become non-compliant, and you die young. And somebody, a very famous psychologist working in ADHD by the name of Russell Barkley, recently published a paper that ADHD will shorten your life by about a decade. He claims that that is due to this problem of not being proactive. I like the your advertiser being proactive is important. I think yes,
right.
absolutely. So
Being
if
proactive.
you don't go and check your blood pressure, how do you know your blood pressure is elevated? If you don't check your lipids, how do you know that your lipids are elevated? And then you go around eating whatever you want, and you have a terrible risk for cardiovascular disease. So I think this issue of going to the doctor, checking and things of that type uh, may allow the person to survive. If you have ADHD, none of these things, they are reactive. So they go to the doctor when something is bad. And at that time, usually it's too late. Uh, if you have a tumor already spread, if you have a chronic disease already has sequela, like if you don't treat blood pressure problems for years, you end up with congestive heart failure. You may have a cardiac creep. So those are the issues that we face in the field.
And also off air, we were talking about one of the big risk factors for not treating, for people who are untreated attention deficit, is it affects their self-esteem.
The treatment?
Yeah, no, not being treated. If they're
course,
not treated,
yeah,
their self-esteem is unaffected.
I would say that the problem very often is in pediatrics that the ADHD is a frontal lobe disorder. So in order for you to visualize and be aware that you have a problem, you have to have a good frontal lobe.
Mm-hmm.
So very often children will tell you, I don't know what my parents, why my parents brought me to you. I don't have any problems. And I know that they have problems because the children that were expelled from school that day, and they say, how is school? Oh, fantastic. Okay. So the absence of awareness that this is a problem also creates obstacles. So those children that are not aware, the moment that they can, will stop treatment. Okay, with dire consequences. Imagine you go to college, you stop the treatment, chances in a difficult environment like college life to succeed. You don't go to college to party. So the idea that you'll party playing in computer games day and night because nobody supervises you, it's not conducive to academic success. It's a terrible problem. So this absence, of course, that's not the case in adults, because by definition, the adults that seek treatment are aware that they have a problem. Okay? So it's a very different environment to treat it, and they are very grateful to be treated and very appreciative. But no, it's not only the case in pediatrics.
So with that in mind, we've got a couple of minutes left, but what percentage of people who are diagnosed with attention deficit as children will continue to have attention deficit as adults?
About 60%.
Wow, about 60%. That's whether it's treated or not.
Whether it's treated or not, yes.
That's fascinating.
Much of what I try to impress upon you, the difficulties that people with ADHD are beyond ADHD. For example, if you have executive function deficit, difficulties planning, organizing, they don't respond very well to medicines for ADHD. So these people continue to have troubles at work, and those people that have learning disabilities like dyslexia, for example, you continue to have dyslexia. Those people that complicated with addiction, depression, things like that, they're not starting adult life on the right leg if you are right-handed.
So we're getting towards the end of the show. Let me ask you. We ask all of our folks who've been our guests 2 questions based on what I call the I am approach. So we're always doing the best we can, influenced by 4 domains: the home domain, the social domain, the biological domain of your brain and body, and what I call the I see, how I see myself, how I think other people see me. These 4 domains interconnect. So a small change can have a big effect. Just like when we add a medication, we're making a small change in the biological domain that can have a huge effect through all the other domains. What small change can you recommend to our listeners who may or may not have ADD?
I will answer the question with an imagery and not directly answering your question. I think what decisions that people make in life are very personal and important, and who am I to tell people what changes you need to do to change your life? But it's true that small changes can have. I use the following imagery with my residents, that if you have an obstacle in front of your vision, like let's say fence, and I give you a small step ladder that elevates you from the floor just a little bit, but you suddenly can see the horizon. Okay, so sometimes in our management of diseases, chronic diseases, let's say, I remember I was privileged in participating in the first clinical trial for pediatric obsessive compulsive disorder, OCD. And I
Dr.
remember,
Biederman,
yeah,
one sec. Folks, I want you to listen to this on Facebook Live because we're going to come back to this in a minute and hear that story. The second thing, you control no one, you influence everyone. The four domains interconnect. We are influencing people. Dr. Joseph Biederman, what kind of influence do you want to be?
well, I think that I had the privilege of changing my field, as you said in your kind introduction about me, the publishing scientific papers. I'm not evangelical about any of these things. So I put the papers, data in front of my colleagues, and they have to judge that
Right.
we can make those changes. And those changes are the ones that I talked about,
That's
pediatric
great.
mania, adult ADHD.
Thank you so much, Dr. Biederman. This has been an incredible show, folks. Folks, we'll see you next week. We're going to be talking with Mark Stiles about the IM of real estate. Stretch the canvas.